All right. Hello, everyone. Welcome to today's webinar. Before we get started, just a couple of those normal items to take care of. We will have time for questions at the end of the presentation. You can type those in by clicking either the Q&A box or the chat section in the lower portion of your control panel. We'll be posting a recording of the webinar on our blog. The link for that will be shown at the end. And if you'd like a PDF copy of the presentation, there will be a link to download that on that same post as the recording. If your question does not get answered today, or if you think of anything else, please reach out to our support team, which the contact information for that will be shown at the end as well. All right, so what is on the agenda for this month? At Health Check 360, our main goal is to help you live happy and healthier lives, right? And a big part of being happy and healthy is working to prevent disease, right? It's kind of the purpose of living healthy, a healthy lifestyle. It's about feeling good now, but it's also about trying to prevent issues that could pop up. So chronic diseases specifically are defined as conditions that last 1 year or more and require ongoing medical attention and or limit the activities of daily living. Chronic diseases like heart disease, diabetes, and cancer are three of the main areas and are the leading cause of death and disability in the US. 70% of annual deaths are due to chronic diseases, and 75% of our healthcare dollars are used to treat these diseases. Those are some sobering facts, I know, but the great thing is that making changes in your lifestyle can help prevent or lessen the severity of, or at the very least, delay the onset of some of these chronic diseases. So let's get into some things to start doing now to kind of help in the future. Before we get into some of the actual healthy lifestyle things that you can change, I want to talk about some other areas as well. First is just knowing your family history. If you have access to it, this is really important information for your doctor to have in their records and can determine what types of screenings they recommend, which we'll get into a little bit more in a bit, or what areas of your health you really need to pay attention to, as you may have some genetic predisposition to certain illnesses or diseases. Knowing information about your immediate family, so parents, grandparents, siblings, kids, even grandkids, aunts and uncles, nieces and nephews, can be really helpful for your doctor to know. Make sure you get both mother and father's sides and then the details if they do have any history of health concerns. Things like what they're diagnosed with, what procedures they've had, if they did end up passing away, and then at what age all of those things occurred. Now, again, I know not all of you may have access to your family records, and that's okay. But if you do, just make sure you take advantage of that fact. You should share your health history with your other family members too, yours specifically, so that they can do the same thing. And then, of course, be sure to update it as needed as things pop up. Next thing to keep in mind is really just to track your trends. Paying attention to changes in your health is the first step in preventing major issues from surprising you, right? And hopefully preventing some of those issues in the first place. So, for example, depending on how many years you've been with us at Health Check 360, you can use our yearly screening biometric numbers to track your trends in things like cholesterol, blood pressure, blood sugar, all of those things. Or if you have your numbers each year from your doctor, ask them to look at past years so that you can compare and look for any of those trends. It's really easy just to see a snapshot of your numbers and say, okay, yep, those are still in the low, the moderate ranges, nothing at a high risk range, and then you forget about them until the next screening or the next year, right? But paying attention to those trends, even within those risk ranges themselves, is still a great way to pay attention to make small adjustments now so that you can prevent those numbers from sneaking into the higher risk ranges and causing illness in the future. It's a lot easier to make small changes now rather than having to react to big, possibly expensive issues in the future, right? It's also important to pay attention just how you feel. If you're feeling more tired throughout the day, if you're not sleeping as well, if your mood has changed, all of those things, all of how you feel could point to some issues going on the inside And they can be an indicator that some changes need to be made or something needs to be checked out, right? It's obviously not as clear cut as, biometric numbers and other things, but you can still make changes based on those feelings. If you pay attention to how you feel, make some small changes, and then you continue to monitor that. And if you start to feel better, then you know you're on the right track, right? Just little things, paying attention to how we feel is so important and such a big thing. And then, of course, physical changes as well, right? Paying attention to your skin, look for any differences in moles, giving yourself regular breast exams, paying attention to different aches and pains, and following up with your doctor as needed. Now, of course, we know as we do get older, we get more aches and pains, things like that, but not all of them are inevitable, right? Not all of them are part of aging. So if there's any concerns that you have, get it checked out. And I know I just saw in a note here, being labeled as a hypochondriac, so someone that runs to the doctor for any little thing. Yeah, I mean, it is something that might pop up, but you have to be an advocate for your health. If you don't feel right, it's still better to get checked out. And if you have a doctor that is putting you in that bucket, might be time to think of a new doctor, maybe get a second opinion on stuff too, right? So again, you know how you feel, be an advocate for yourself. Good point though. All right, along with all those daily things to pay attention to, let's talk about those screenings again. Getting your recommended screenings is a huge part of staying healthy, and then catching any diseases that do arise as early as possible, right? So that you can start treatment if needed, or just make lifestyle changes accordingly to either cure, hopefully, again, lessen the severity of anything that may pop up. Now, there are a lot of different preventative screenings that you can do. I've listed just some of them here. You got cholesterol, blood sugar, and blood pressure. Those are done with either us or your doctor typically, right? So those are usually covered standard things, but things like those skin checks, dental exams, eyes, ears, lungs, coronary or heart testing, colonoscopies, colorectal screenings are important to keep up with. And then you've got the sex-specific exams. You got pap smears, mammograms, ovarian screenings for women, testicular, prostate for men, bone density and thyroid screenings, generally more geared towards women. But again, depending on your history, it may be recommended for men as well. Again, talk to your doctor. And I know some of you are already thinking, well, how often should I get these tests? When should I start them? At what age? I'm not gonna go into that too in depth today, just because there's general recommendations out there that you can look up on American Heart Association, CDC, all of those great websites, but it really varies depending on those individual factors, like your family history, your lifestyle habits. If you're a smoker, for example, you're going to want to get some of those other tests done earlier, like look at your lungs, those types of things. Depends on your age, depends on your sex, depends on your ethnicity, because there are different risks that are higher for different people. So again, and work with your doctor, do your research. You can do a lot of research online, but then verify, of course, with a professional to determine how often, how early you're getting these screenings. If you do have a family history of anything, typically you will be screened earlier and more often, right? That's how it works, which is why knowing your family history can be so helpful. But those first ones listed, just as a general, again, recommendation, the blood pressure, those types of things should be done yearly or every 6 months, for example, with the dentist. But after that, it's really going to depend on the person and those factors I mentioned. So one side trip I kind of wanted to take today is specifically about heart disease. Since that really encompasses many different issues, and it actually can affect as many as 50%, 1 in 2 adults in the US, as well as other developed countries. Those are where the stats are. When doctors and other experts talk about heart disease prevention, there's a few different areas that they talk about. So I just wanted to touch on it because even if you've already had an incident with your heart, for example, there are still so many different things that you can do that are considered preventative, and hopefully your doctors talk to you about this, but there's so many different things that you can do even after something happened to help, specifically with heart disease. So secondary prevention is when someone has already had something like a heart attack or a stroke, you've had heart surgery, or you're developing some other form of heart disease. So the same types of things that help prevent heart issues in the first place still apply to someone who is recovering and can help prevent you from having another event. So it includes things like, medication if the doctor prescribes it to lower cholesterol in the blood, those types of things. But quitting smoking, increasing your exercise, doctor monitored, doctor prescribed, of course, if you've had an issue, and then changes with your nutrition. The number one killer of individuals who survive a first heart attack is a second heart attack, okay? But you can help prevent that second attack by making changes in your lifestyle. It's not all over after you've had some issues. It's never too late to change, which I'm going to say again in a bit. Primary prevention is aimed at those people who haven't had any sort of specific event yet, but you have risk factors. So high blood pressure, high cholesterol, for example. Again, the prescription is going to be similar. Healthier lifestyle, medication if needed, again, chatting with doctor. And these changes are still extremely important, maybe even more important now that we're seeing some of those risk factors already developing, right? And then we have primordial prevention. So primordial means from the beginning, and that's what this type of prevention means. It means hopefully preventing those risk factors like the high blood pressure, cholesterol, being overweight, which causes inflammation, atherosclerosis, which is hardening of the arteries, preventing things like that from hopefully even beginning to develop. The American Heart Association uses this as its primary definition of how they approach heart health and how they advertise it. So the earlier you start healthy habits, the more likely you are going to prevent issues, right? It's common sense, but I think people need to hear it. Practicing healthy habits as a child. So think about your own kids if you have kids. Practicing those healthy habits as early as you can, even now, again, no matter what, depending on how old you are, it'll give you a better chance for the healthiest outcome, right? So the earlier you can get your kids or yourself to get those healthy things, that's going to give you the best chance at the healthiest outcome possible for you, even if you have genetics or other risk factors working against you. I promise your lifestyle can still make a difference. You can change so many things, right? We're going to go into that here in just a second, but I just want you to know you don't have to make major changes. I just want to make that point. Any small change you make can change your trajectory. Every little thing helps. You can change the course of your life by making a change at any point. I know I just said starting as a kid is the best, but obviously we're not kids anymore, but starting now will still help. All right, on that note, let's get into some of those daily things that you can do to help manage if you already have some risk factors, to help prevent if you're not there yet, or prevent another incident. All right, so you're going to hear a lot of things if you do listen to webinars. You're going to hear some reiterations, but it makes sense. It's not complicated. We have similar rules for everybody to stay healthy and prevent disease. So nutrition is a big one, right? What you put in your body is a massive indicator of how your long-term health is going to react. So just pay attention. You don't have to be perfect. You certainly don't have to skip your desserts, right? But the more you eat healthier options, the better off you'll be, right? It's as simple as that. The better you do, the more benefits you're going to get. You're still going to get some benefits from eating healthy some of the time, but you're going to get more from eating more. Again, makes sense. When we're talking about our main areas of chronic disease, so heart disease, diabetes, cancer, nutrition can go a long way. So a lot of these tips are going to overlap with other areas too, with nutrition. Speaking of heart disease, we're going to start with that first, but let's go through it here. Fruits and veggies, which you all knew I was going to say, right? They're full of nutrients that help our heart. Things like spinach, kale, broccoli, those nice green leafy veggies are great foods to add to your diet. So fiber, vitamin K are some of the benefits that specifically help the heart. Fiber can help improve cholesterol, blood pressure, and inflammation in our bodies, as well as help control blood sugar levels. Vitamin K plays a role in blood clotting proteins and possibly helps prevent hardening of the arteries. Things like blueberries, blackberries, raspberries are really good options for fruits. So they specifically have antioxidant properties, which can slow down or prevent damage to cells caused by what are called free radicals, which are just unstable molecules that can cause issues like heart disease, cancer, those types of things. Healthy fats are great for the heart too. Fatty fish is as an example, salmon, tuna, sardines, mackerel, great options to get in omega-3 fatty acids, which are known to have really good heart benefits. And then other things like walnuts, almonds, cashews, those other types of nuts have really healthy fats in them as well. And these aren't all the examples, right? But those are some just things to get you started, get you thinking. Whole grains, meaning specifically 100% whole grain products are also really heart healthy, and that fiber is the big thing. Oats, quinoa, rye, barley are examples of specifically whole grains. Be careful with your grains. We don't need to cut out grains, but you just need to make sure that they're good quality. So with diabetes, again, rewind and I'll say the exact same things I just said about heart disease. Whole foods like fruits and veggies. Some people are concerned about the fruits and the sugar content. And yes, you need to be mindful of the sugars in fruits, but overall, if you're eating whole foods, whole fruits along with other healthy foods, it's not going to be a factor, okay? Veggies specifically have that good fiber, which can slow the absorption of sugars in our body, which can help regulate those levels. Again, healthy fats are going to be helpful. We tend to think about sugars and carbohydrates when we think about diabetes, right? But healthy fats in things like nuts and seeds and those other things I already mentioned can help our body actually regulate sugar as well. Sugary drinks are, of course, extremely important when we're talking about diabetes prevention specifically. You get such a large dose of sugar in one drink, and it does so much damage. It's really hard to defend drinking sugary drinks. I know that's hard to hear, but we're going to pull out some tough love today. Just in one study called the Nurses Health Study 2, so the second one, women specifically, this was geared towards them, who drank one or more sugar sweetened beverage per day had an 83% higher risk of developing type 2 diabetes compared to those that drank less than one per month. So basically none, I would consider that. So 83% is a big deal, right? So if you drink a lot of sugary drinks right now, just make some small goals, work your way down. Again, not perfection. We're doing progress over perfection. Do what you can. Now, again, the advice for the first two are going to stay true for cancer prevention as well. We know there's a lot more factors that go into cancer, right? And obviously, and these other conditions as well. But if you eat well, it's only going to help you in the fight against disease and cancer, right? It's not going to hurt you if you're eating well. So give it a try. Do what you can do. Portion sizes too. I just threw that in there because it's a simple step that can get you started, that can sometimes ease you into healthier habits. So you don't have to change what you're eating right away. Just lower the amounts of the not so good things, right? Cutting down on things like your processed food portions, your sugar portions, which I already mentioned, those types of things can help pave the way for eventually adding in some healthier options. Alcohol use has some different schools of thought when it comes to health and disease specifically. Now, there are some studies out there that point to moderate, I wouldn't even call it moderate, low alcohol use being the keyword low or moderate, possibly having some benefits with our health, right? You hear of red wine sometimes with some of those antioxidants. The thing to remember, and if you read these studies with the advice, is that they still don't recommend starting to drink if you don't currently, most of them anyways. But if you currently do, then you just need to limit yourself to 1 drink per day for women typically, and 2 for men, to avoid the negative effects that come after that amount. So here's the deal with that. If you're at that amount, you typically can get some good, and I'm not going to say always because it's still, we don't know for sure, but if you stay for that 1 or 2, anything above that, the there's zero benefits, and it causes a lot of harm just within our body, because there's different functions that our body has to do to process the alcohol. It's not just the sugar content, it's not just the carbs, those types of things. There's a lot that goes on with alcohol in our body. So again, if you are, limit it. If you don't do it now, don't start. Sleep improvement is another way to help keep us healthy and prevent some of these illnesses. Not getting enough sleep or poor quality sleep, it wreaks havoc on our body, right? It's been linked to the development and poor management of diabetes and heart disease, as well as linked with obesity and depression, which can worsen those issues that do come up. What are some things that you can do? First is create a routine. If you can go to sleep and wake up at the same time, that's perfect. I know that's not realistic for everybody. So if you can have a similar routine before you go to bed, you can sometimes shift the time, and it can still help get to sleep quickly and help that quality. So unplugging from electronics, listening to music, reading, taking a warm bath, deep breathing, meditation, those types of things. Anything that relaxes you is good. And if you're thinking you don't have that much time before bed, that's fine. Just pick one thing. You can even do 1-minute meditations if you have time, and then create your routine accordingly. Any small thing can help that sleep. And then, of course, focus on your environment. So keeping the temperatures cool, using a noise machine if you have some outside noise, keeping it as dark as possible, looking at the quality of your bed, your mattress, your sheets and pillows are areas to think about. I always recommend sleep.org, as they have some great tips on sleep if you're interested. We've done other webinars as well on sleep. So take a look at the blog and dive more in if you want to. All right, more healthy habits. Exercise. Exercise helps us feel good physically and mentally, right? It helps us maintain our weight. It helps strengthen our heart, and because it's a muscle like everything else. It helps relieve stress. It releases healthy hormones and so much more. So if you already have issues with your heart or any other chronic disease, your doctor is likely going to recommend regular activity to help manage or improve your symptom, right? Overall, generally for the most of the population, recommendation is 150 minutes of moderate exercise or 75 minutes of more intense, and then 2 days per week of muscle strengthening activities. Now, it doesn't have to be in big chunks of time. You can break that up into any increments you want. Just look at your schedule, see if you can find a few minutes to just move and do what you can, right? It doesn't take that much to start to see improvements in especially your mental health, in my opinion. The key is just to get started, and you can continue to build from there and see more of those benefits to help prevent some of those issues. You do have to progress with exercise to keep seeing the benefits, but you can change it up, you can do different things, and it'll work out great for you. And then stress management, of course. Stress can increase inflammation in our bodies. It raises blood pressure and can keep it elevated if we have chronic stress. It releases negative hormones, which all of those things, again, put us at a greater risk for these chronic diseases. But you can still do steps just like everything else. So first, my tip is figure out what stressors you can change. Control what you can control. Can you avoid a certain situation? Can you turn off the news? Can you turn off social media? Some things we can change, right? And if you can't change it, that's part of it. Stress is part of our daily lives. There's no getting around it. Stress isn't a bad thing all the time, but to use to our advantage, we can't let it take that negative tone. We have to change our mindset about it. So if you can't control the stressors, you can use other tools to help focus on the positive and make the positive outweigh the negatives, right? So one way to do that is to practice gratitude. So easy, again, to focus on the negative. Our brains are actually hardwired in some sense to do that. So take some time each day to really focus on that positive. Be intentional. And then as you focus more on the positives, you will start to notice them more throughout your day. And then your brain will make that better connection. And then we've got things like breathing and meditation. Taking one breath, taking 30 seconds, taking a minute just to stop and breathe makes us physically calm down, making it easier to respond rather to react than stressors. I've talked about that before, but it also physically helps us. We're not releasing some of those bad hormones. Our blood pressure goes down. All of the positive things start to happen again when we can just stop in the moment, take some deep breaths and do what you can. Meditation goes along with that as well. You know, it's one of those things where you can schedule meditation, right? There's lots of good apps out there. Calm, Headspace, Insight Timer are a few of the favorites of the coaching team. So look into that, see if it's something that you want to add into your day. But again, for that in the moment stress, that's a great thing to do. The last tip I have on stress is just to create a stress relief toolbox for yourself. Simple, just make a list of healthy ways that you like to de-stress. So listening to music, reading, some of those things I talked about before bed too. Gratitude journal, whatever makes you happy. And then, as I always like to say with this too, do at least one of those things every single day, even if you're not stressed. Doing those things when you're not stressed helps you deal with the stress you have, or that you maybe not even know that you have. It can help relax you, calm your body. It's also going to help you handle the stressors that you aren't anticipating because your body's more in a relaxed state already. And then the final tip I have today for preventing chronic disease, this is all over if you do your research, quit smoking, lower your exposure to secondhand smoke if possible. Universally accepted by doctors as a major way to lower the risk of heart disease, cancer, and type 2 diabetes, among other health concerns. The big thing here is even if you're a longtime smoker, quitting now can still lower your risk of developing or worsening concerns with chronic disease, okay? There are so many support systems out there, and I was going to put this number on there, but 1-800-QUIT-NOW is a great number. It's available to anyone. It can start. Some of your companies may offer nicotine cessation through health check. Otherwise, you're still able to talk with a health coach about some tips and tricks without doing a specific program. You can shoot us an email if you want to. Talk to your doctor, see if medication is right for you. Otherwise, you can try those behavior change techniques as well. The step down method, where basically you just track how many cigarettes you're smoking per day and then work to cut down just one at a time, is a really easy way to get started. It's that mindfulness, it's tracking, it's becoming more aware of what you're doing so you can start to cut down. I know there's a lot more to it than that, but that's a good place to start if you're not sure where to start. Now, these aren't the only things to do to stay healthy, right? We know there's so many ways to stay healthy. So do your research, find some ways that you can take some small steps to improve your health, but just know that no matter where you are in your life, you do have control and you can do things that can help your situation no matter what you're fighting against, whether it be lifestyle, whether it be genetics, those types of things. Creating a healthy lifestyle at any point in your life will help you physically and mentally and help prevent some of these things from popping up. All right, let's look at the upcoming webinars before we jump to questions. It looks like you guys are in the chat going back and forth, which is fantastic. That's what we want. But next couple webinars, we are at December already, end of the year. I can't believe it. But putting your health first. It's easy to put our own priority, down the list of our own health, right? So we'll talk about things to kind of help keep your health a priority. And then January, new year, fresh start, new goals. We're going to talk about locus of control. How can you change your mindset and motivate yourself and focus on those things that you can control? Hopefully let go of some of those other things, but changing that mindset is going to be a big part of that one. So hope you join us there. And then lifestyle rewards. If your company does have you submit the questions for lifestyle rewards, these are going to be it. You can download these questions if you're not able to take a screenshot or take a picture of these right now. You can download these questions on the blog once we put the post up. Again, most of you probably won't have to submit, but if you do, these are the questions that you will have. And then here's our contact information. Of course, we're on social media. Where we have the past webinars and other articles on our blog. You can register for upcoming webinars. I don't think we have the 2023 out quite yet, but it should be up very, very soon. And then you can contact a health coach. Give us a call. We can set up a time to chat. You can email us with any questions that you have. We're more than happy to reach out or to chat with you with anything you'd like to talk about. And yeah, I will end the recording here, but let me stop with some questions, see if we've got anything.